Okay, good afternoon, everyone. I'd like to welcome you to this webinar on TRAKnet Professional Billing. My name is Dr. Alan Bass. I'm the Medical Director with Nemo Capital Partners in TRAKnet Solutions. Joining me today on this webinar is Ms. Brooke Weaver, who is one of our electronic health records consultants in one of our trainings. And what our focus is going to be today is going to focus more on the billing side of our program and the TriZetto integrations within TRAKnet. We have several hundred people who have registered for today's webinar. So while we will try to go through the material and answer some questions. We're going to probably take most of the questions that come out today, if we can't answer them, put them together in a frequently asked questions document and put them up on our website. So everybody is on mute. So what I'm going to do now is I'm going to turn it over to Brooke. We're going to, like I said, take about 40 minutes maybe to go through this and try to answer some questions near the end. So Brooke, it's all up to you. Why don't you take it away?
Well, thank you, Dr. Bass. Good afternoon, everybody. I thought what we do is start with our scheduler. Since everybody's day starts with their schedule, that's where we're going to start. And I wanted to show you some of the features that have new functionality in 3.0 that you don't have in 2.0, or maybe some that work just a little bit better. The first thing I want to show you is the schedule just is your schedule. However your schedule is set up in 2 comes over. But you still have access, we have access to insurance information and our copay. So when a patient comes in, you can still take your copay from your scheduler. But the insurance button gives us a much broader options here. You can see the insurance, but if your patient changes their insurance, you can add it here. But one of my favorite features that I use every day is now the integrated patient eligibility. I can click on my eligibility, and as you can see, this is actually my insurance. Yes, it is from last year because my insurance changed this year and I don't have my new information in there. But I wanted to leave this so you can see the information that you get now through the integrated. Hang on. That was weird. You get the policy information, your coverage, copays both in-network and out-of-network, as well as specialist copays, the deductibles, and some out-of-pocket. You can also flip over to see if they have separate DME benefits, which come in quite handy. You are also able to print this. We print this out in our office and give it to our patients so they see in real time. I'm sorry, there we go. My Outlook keeps popping up, sorry. You see in real time what their insurance is. If I were to refresh this, this would all come back now blank because this is from last year. But I wanted to show you this is great ease of reading now, that the integrated eligibility or the patient eligibility in 2.0 is very hard to follow. This is very easy, very well laid out, and printable. The copay, when you click on receiving your copay, it pops up your receipt right then and there. And once you take in your copay and save it, you're now grayed out and it shows your copays collected. So this is where I wanted to start. This is our chart. This is our scheduler. We can still go to our patient chart by clicking on the name on the blue hyperlink, which is what I'm going to do right now. And there's my alert. In my chart, I've set up my billing dashboard for information that I find most beneficial for my role in the practice. But again, I have my insurance information front and center, and you'll notice when I click on that, I get that same window and eligibility information. So that's just one more place I can access that as well. And if I come into the billing tab, again, I have the insurance information. I can access it there as well. So this is something that we can access all throughout the patient's chart, anywhere we have that information on insurance, just to click on and see where we stand. I'm going to take you just a little bit through the patient's chart in the billing. We start with our insurance, our authorizations, so if you have any referrals or authorizations, those are still there. Our ledger, we actually now have some filters out front to help you sort through and maybe not look at those long-time patients' ledgers that you have, 5 and 10 years long, as well as the simple view that we're all used to in 2.0, which gives you your billing, your allowed, your deductibles, your copays, all the payment information in that simple view. And our statements, to add statements, if you needed to hand one to a patient right then and there, you can just click the Add Statement button and it'll pop up your statements to hand out to your patient in the office. The collection module, if any of you use that, that's there in the chart. And if you use any billing remarks, maybe you filed an appeal or you've talked to a patient about a bill, any type of remarks that you want to add to billing are there. It's a nice tool. I never used to use it until recently, and I found that it gives us a lot of benefit information, but it also will show up when we get to the invoice. So that kind of will give you a little alert, and I'll show you how that works too. So let's come back to our schedule. I went ahead and created 2 encounters for both of these test patients. And we're just going to go into them just like you do in 2.0. We can modify them. That'll open up the encounter, and it opens right into the note if you would like. And our invoice tab, instead of being first like it is in 2, is actually third now. So when we click on our invoice, you'll notice the screen looks a lot different. One of the new features is having access to past billing history. So you could see your patient's past billing history, maybe what's still open, what was billed, what was coded. So that's a great tool to have now, so you can go back and see where you stand with that patient. And again, our insurance information is now at the bottom of the screen. So instead of being hidden like it is in 2, it's right there on our invoice screen. And again, if I click on it, you'll notice I get that tab and information again. So it's one more place we can access information on insurance. So all of that is on your main invoice screen. I want to show you a couple of different views that we have of it now, because for a lot of us this looks different than what we're used to. The charge edit view, actually that's a little bit more what you're used to seeing with the drop downs and your modifiers in there. Oh, I have to take off the bill already, my bad. So you can see your list of diagnosis at the top, and your drop downs are still there. If that's a view that you prefer to use, the only thing I'm going to remind you is to hit save at the end of any line that you change to make sure it saves that information. And then we also have our payment view. So you can see a payment view history on that encounter as well. So let's go back to our charges. And if you double click on your line item, it brings up a wonderful treatment box, which gives you the full words that go with all those diagnosis codes. So sometimes if you just need to double check what your diagnosis code is, you can pull that up and it gives you the full descriptor. And the same with the modifiers. Sometimes I need to see the words that go behind those modifiers to make sure I've got the right one there. What I also want to show you is this red exclamation mark. It says remarks. Remember I mentioned back in the patient's chart those billing remarks? There's that remark. So it shows here, so that gives you a little warning that you have a billing remark that maybe you need to take a look at, and that will pop up in your screen. So you don't have to go back to the chart and look for anything. Well, most of the information you're looking for is accessible right from here when it comes to billing. Some of the changes is Bill Ready is now in the lower left-hand corner instead of the upper right. Just a quick change. Our claim details are still our claim details. You have referring provider information if I had a date last seen, you'll notice now box 19 is actually visible on our claim screen. So our details, that tells us we have the right information in box 19, or if you need box 19 for any comments, that's now front and center for us. If you wanted to preview your claim, you can, still either in the ANSI or the Claim 1500 view. Claim Wizard has changed and it's become a whole lot more user-friendly. So now when you go into Claim Wizard, you can select your items to send them, and if you need to change the carrier for the other ones, especially when we split out a Medicare and a DME claim, you can work all of that from right here. You don't have to continually go back to the invoice screen to access your Claim Wizard. It's all right front and center, which makes that much easier to use. And again, if you needed to change your place of service, this is where we would do it. So that's where all of that takes place. Claim Wizard is now its own little window, so you're not continually having to go back to your invoice. We still have our claim check. Obviously, I have no diagnosis on that one line. And any claim history that you might have with that claim. So if we needed to delete claim history, that's where claim history is now located. So on my invoice here, I'm going to go ahead and just add a diagnosis code just to make sure those are there. And there are individual line claim details for just that line if you needed to add anything there. Or if you need to add any comments, you have your comment box. Stick another one on that one. So now if I look at my claim and I've got everything the way I want it to be and it's there, I can then check my bill ready in the lower left-hand corner. I'm not going to sign it because I'm not the doctor, but that's why that's still red, but I'm going to save and close. So for these two, like I said earlier, I went ahead and did two little invoices for these, two little quick notes to get us some invoices to work with. And again, you can see how that all comes through on our screen. Now, I want to take you to the billing dashboard because this is where things have, I think, changed a lot. In 2.0, you've got your icons were kind of scattered across the desktop. Here, they're all consolidated into one place. We have our encounters, our payments, claims, statements, collection, and reports. So anything and everything that deals with billing is all together under this billing tab. I'm going to change my date on my encounters because these were on Saturday's schedule because that's what I was playing with. There's my two claims. So you'll notice that our encounters list has now changed a little bit as well. It not only tells you the patient's name, but the provider, it gives you their insurance company and the balance on that charge, and whether it's charted, bill ready, patient responsibility. These are new, and I want to point this out. If you are still using 2.0 for your charting, you can actually come into and start working your billing out of 3.0. It will tell you what version the note is and what version the diagnosis is. So you can start using 3.0 for your billing if you're not already, to start getting familiar with it. But this will tell you if it needs to be, the version needs to be changed in the billing or not. So keep an eye on that if you want to start doing that. I'm going to go ahead and show you what happens when we click on an encounter from here. Unlike the scheduler, when we click on Modify Scheduler, when I do it from this encounter list, it brings me directly to that invoice. You'll notice here we have the option to go to the patient's chart from this point, save and close, or close. So if I go to my patient's chart, maybe I want to see if we've ever sent them to collections or whatever alerts I have on my dashboard. And to get back to that encounter, all I'm going to do is click back on my billing dashboard tab. And that brings me right back to that invoice. So once I have that there and I'm ready to go, I can save and close. And now both of my encounters are bill ready. that leads us to, once a claim's ready to go, we're going to actually come to our Claims tab. And again, I'm going to change the date for Saturday since that's what we were playing with. No, I want Saturday. There we go. So these are our 2 claims that we were playing with that we created. And some of the things I want to point out here that make this a little easier and a little more user-friendly is we can actually sequence out if we only wanted to send out our secondary claims or our primary claims. We can sort those out, and we can even select, maybe we have a batch of claims that need to go by paper. I could sort out just my paper claims and send those to the printer, and those would print out. So you don't have to do each one individually. I could actually sort those and filter them. I also could select all and change their output methods. So this is very helpful when it comes to secondary claims. Sometimes we forget to change that output to none. I can do that here, and once I do that, it actually tells me I'm going to change it permanently, so I don't have to keep doing it on the chart over and over again. So now that's changed my output to none, and if I want to change it back, I can change them back. Very easy to do, but a very nice feature to have now. And while we're in claims, that's going to bring us to our next link out to TriZetto Gateway. You'll notice in your upper right-hand corner, while you're on your claims screen, you have a Gateway EDI icon. When I click on that, it's going to log me right into my gateway. I don't have to go out and log in. It's going to log me right in, bringing you right to your dashboard. Typically what I do is I come into my downloads to look at my new remits. I saved one from this morning, so we could just show you how easy this is to do now. I've already printed it out, so I already know what patients those are for. And just click my download. Now that's done, I can click right back to my screen in TRAKnet, and I can receive that. This doesn't matter what view I'm on. I'm just going to hit receive, and that will bring in that EOB that I just downloaded from Gateway. It takes just a minute. It was a rather long one, if I remember correctly. In 2.0, you always have to hit receive twice. In 3, you only have to hit it once. And there it tells me my remit's processed. And you'll notice I did just 2 this morning, but it tells you how it came in, who the payer was, the check ID, and the amount. When you double-click on that, it's going to open up that EOB. This is for real patients, so I'm not going to do that at the moment. But that's just how easy it is to do our gateway. So our gateway icon logs us in, takes us right into our account. We download them, and here they are. The other thing I would do at this point is I don't even have to leave this screen to send out those secondary claims. I could go back to my pending unsent, and it will pick up all those claims I've done today that need to go, as well as the secondary flipovers for my Medicare. The next button down is our statements. Statements, I don't know if a lot of people were aware in 2.0, there were filters in statements, but they were kind of hidden back under a tab. Here we've gone ahead and brought these filters forward. So I could actually filter out my minimum and my maximum balances. Maybe I want to send statements to anybody who has a balance over $5. I usually put it in a penny to make sure I got all my little PQRS adjustments out of the way. And then how many days since their last statement. That's right here. And if maybe I only want to do past due ones. So I have my statement options all right up front now. I still have the option to work them by letter if I want to do by letter. I also can see any unapplied payments from here at this point. I can just click my unapplied and it will bring up any unapplied payments I have, and I can work unapplied payments from here as well. Just to make sure before I send out statements that I've applied all the funds to that patient's account. I use Gateway TriZetto for my statements. I love the job that they do. It's so much quicker than having to try and print and stuff envelopes and worry about postage in my office. I can go through and work my statements, and then just the ones I select, hit my export button, and they take care of it from there. And I don't have to worry about it. Nice professional looking statement, postage, return envelope, all goes out to that patient. They get a good, clean, nice looking official statement, and as we know, patients are more likely to pay on their account if the statement looks very official. And I'll give you a little plug there. That is one of my favorite things to do for statements. I don't have to worry about them in my office. I just send them out to their site, and they handle them for me. Let's see. The other thing I want to show you, as long as we're in here, is you still have all of your icons right here. I'm going to skip over for collections right now. Our reports are still our reports. Those didn't change. There's our old reports and our queries. I left out payments in the beginning just for a reason, because I wanted to show you how we can send and receive our claims pretty easily. Payments, this is where all the incoming money is. Whether it's a patient handed a payment at the front desk, or a payment came in the mail, or you want to look at those insurance payments. I can even filter out what I want to see. Maybe I only want to see my insurance payments today, and there they are. Or maybe I want to see any unapplied balances. I can do my unapplied. So that's your unapplied payment report as well. So when you're looking at those unapplied payments for the day, the only thing you would change is you would change that to patient and unapplied, and you get your unapplied report so you know what your money is to work for that day. Adding insurance payments or patient payments or provider adjustments. So as you can tell, all of this happens here. All of your payment information, whether it's mailed in or downloaded, these were the ones that were downloaded. These are the ones that were downloaded because it tells me that they were automated. These were a check. You'll notice I even have one today by a credit card. Credit card is an acceptable form of payment now for insurance companies. So that helps keep that straight if you ever had issues trying to match up your reports at the end of the day. What I want to show you is just, we'll go through real quick. When you add an insurance payment, we'll pretend it was one for me. I'm going to click on my insurance company, and I'm going to leave the amount as 0. Once I click save, it's going to give me a warning. Am I sure I want it to be 0? And yeah, on this one, I'm really sure I do. And you'll be, how do I search for a patient here? There's a little button over here that says show pending. That's the only difference in a 0 payment as opposed to one that has an amount. If you have an amount already in there, this box will already populate. If you have a 0 payment, you just have to click the show pending. So let's look for me. Yeah. I didn't actually send it, so it's not going to show anything. We'll pick some old stuff I was working with. You'll notice I unclicked some buttons over here. One is balances only, and one is this payer only. The reason I did that was to make sure that we could pull everything. That will pull everything in that account for me. This comes in handy kind of when Aetna's bought up a lot of secondary small companies and looking at buying some bigger ones. I can uncheck this box and apply that payment anywhere to any insurance company patient. So let's do, we allowed 100, and it all went to my deductible because my insurance is lousy. Once I add that, and I add that to that, that's going to drop to my bottom line. So I know that one's been applied. If I need to take that payment off, maybe I put it on the wrong line, I can simply remove the payment, and it brings it back to the beginning. So now we have a payment applied that went to deductible. I'm going to close this. and show you if the patient were to, now that patient has a balance, that'd be me. And maybe I made a $100 payment. And there's that $100 payment that I have that's patient responsibility. And I can just hit balance and that'll apply the full payment to that line item, or I could break up the amount if I needed to. I'm just going to do the whole balance there so it zeroes out and close that. Now, as long as we're in payments, I'm going to actually filter out that patient payment. I'm trying to, there's that copay that I had at the beginning that's unapplied, so you can see where that is. And there's that. I unchecked the unapplied, and that brings up all of my payments. And there's my payment that I had made. Now, if I needed to delete this payment, and this is one of the new features in 3.0 that I absolutely adore, if I click on remove that payment, a little window pops up, and it asks me to give it a reason why. Or I downloaded it twice. I've done that on accident, or whatever reason. Now not only does that go away, but if I click my show deleted, it tells me who deleted it and why, which is a great tracking for payments that tend to get misplaced, or maybe it was the wrong payment on the patient, or for whatever reason. But that gives us our tracking capability for that payment. The next thing I want to show you is the add provider. We all do provider adjustments. Maybe something needs to be written off. Patient was, unfortunately today I had one that was deceased and we'll have to write off his balance. Used to be in 2.0 when you did a provider adjustment, you would have to kind of know the amount to start with. In this case, you don't. You have the option to add an individual amount or the whole balance, and it calculates for you. You no longer have to know the amount that you're starting with. The other thing that this eliminates is some people I know were having an issue doing adjustments and we're making them patient adjustments, whereas patient adjustments would always go above the line and show as a payment, and it's the provider adjustments that go below the line. So it's now no longer... I'm on a call. Sorry. So you now can do, they'll only show below the line adjustments. They'll only always come in the provider adjustment spot. So once I commit that adjustment and hit save, that adjustment's done. So I no longer have to worry about, did I do that adjustment right? The provider adjustments are always done correctly now. It's no longer an option to do them under a patient. The other thing I want to show you, that brings us back into the patient's chart. So once the patient's all paid and everything, we come back into the patient's chart. We'll use my silly rabbit here. You can still do payments in the patient's chart. So we're all about payments right now. So I can do them on the billing tab under payments. I can still do them in the patient chart. Here I have a penny charge left. I just click here and it can be an insurance, patient, or provider payment, however you want to do it. So we'll do that provider adjustment on that penny. I'm going to show my pending and just hit my balance and commit that adjustment. So as you can see, provider adjustments are way easier now than they ever were before. The other thing you want to notice in here is we have an unapplied payments button. If you click on the unapplied payments, if we were to click on mine, you'd see that $40. There's nothing unapplied for this patient. It would bring you to the payments tab. You would see your unapplied. The other thing I want to point out on the ledger when it comes to payments is now down here at the bottom, you'll see we have a patient, or we have an insurance balance. If we flip to the insurance balance, we can see what's pending at a glance with insurance or pending with the patient. Thought that was a pretty neat filter to have now. Let's come back to my billing dashboard. And I think that takes us through just about everything there on our billing dashboard as far as payments and claims. As you can see, everything's there that you hadn't too. It's just moved around a little bit and added some great new features for us. So I think I went a little quick, and I tend to do that, and I apologize. I'm kind of, it became second nature to me, and I have to stop sometimes and think when I explain things how to go. But I think it's nice now that all of our billing stuff is centralized in one spot. Everything that pertains to the encounters, the claims, the payments are all in that billing dashboard tab. I'm going to ask Dr. Bass, I'm early, if we have questions.
Thanks, Brooke. No, that was really comprehensive. Thanks so much. We do have some questions. First, let me remind everybody that the webinar this afternoon has been recorded. It's going to be placed up on our TRAKnet YouTube channel pretty quickly. I'm going to get this over to the corporate office and get them up there to set that up.
Yeah, I wanted to see if we had any billing questions before we get into the ICD-10 Smartsheet, which is
sure. Let me
cool.
let me see what we got here. We do have some stuff. I've been answering some of the more personal questions for people on where they have to go to. But Brooke, when we have to deal with any sequestration amounts or adjustments like that. From what I understand, I know that we already auto-adjust off PQRS, the penny charges, but what happens for any type of sequestration payments?
That's a great question. That's actually already programmed in there for that adjustment. So when you download that claim electronically, and that's important. If you're going to do your claim entry, anything and everything you can download through Gateway makes that process that much easier, because what sits behind a lot of those sequester are codes. They're adjustment codes, and our programmers have taken into account that that code, and that builds in that adjustment. So it's a lot easier to download them than having to do all of those manually, because there is a secondary adjustment code for that. So everything in there is accounted for.
Okay.
And same with the PQRS codes. The developers did a great job and put those adjustment codes in there for the PQRS penny adjustments as well.
Fantastic. Couple other questions. Can you show how you would do a refund?
Oh, absolutely. That's always a good question. Let's come back into a patient chart, and actually let me go with mine, because I want to get into my chart. So say I needed to refund that $40 balance. Maybe the patient had an emergency and had to leave. So here I am on my ledger. There's that unapplied. I could, if that were the case, I could just delete it. But maybe we need to actually issue a refund. If you have the integrated credit card processing, if you actually do it, it will come off. But maybe we're just going to give them the cash back or a check. So the payment type is going to be patient, because it was their money to begin with. I'm going to do $40, and my type is now a refund. Actually, it has to be a negative $40, and it's a refund. So now once I've saved that and I click on the charges, I could uncheck. Maybe I don't want to see positive balances because it's a refund. It's an overpayment. And I could just put that amount, the whole balance, on that line, and that will create that refund.
Fantastic. Let's see if we have a couple of other ones before we move on. Can you show how you would actually work a secondary claim? Because we don't have, I don't know if we had anybody with, if you were able to set anyone up with a secondary insurance.
If we're talking about, here's the neat thing, when you apply that primary payment, as long as you have secondary information in there, let's see. I'm going to hide these real quick. So this is that Medicare EOB that I downloaded. And actually, this is a great example. You'll see how I have a couple of them that are, say, electronic, but they should all say none. I can just select these two and change their output to none. Change output to none. So now these are all secondary claims, and they're just ready to transition over to secondary responsibility. You'll see I filtered out my sequence to secondary. I'm just going to select them all and hit send. Now, if I had one that was set to be a paper claim, once I selected all and hit send, my paper claim would automatically kick out, as long as that was the output method I had set for them. If I needed to, maybe I needed to print a secondary claim after the fact. Or maybe I needed to send in a paper claim for whatever reason. By coming into my invoice itself and to my claim details, there's that 1500 form. So by clicking on that, I can change my sequence to primary or secondary. A lot of times I have to go back and print them for a secondary that got lost in electronic Never Never Land. I think some secondaries make me send them 3 times before they actually pay me. But I can change my sequence, and when I get print, it gives me that little window and hit print again. And that's how I would generate a secondary or even a primary paper claim maybe after the fact. Maybe I needed to reprint it, which I do have to occasionally for some patients' insurance.
Great. Before you jump into our smartsheet, can you talk a little bit about the collections module?
Absolutely. The collections module has some great options in there. If you ever did, you can set up letters and rules to go to patients. I have, I think I have, yep. I have a couple of rules that I've set up in my collections. You can send them a letter. You can sort them out by who's to follow up by them in your office, how many days, what are your filters? Do you want to send a letter to somebody who's maybe 60 days past due that has, a higher balance? These are all parameters that you can select and filter and then assign to somebody in your office to work. Or I can run a collection report by ones I've sent to collections. The difference being when I do that, let's come back to the patient chart real quick. You'll notice on my dashboard I put a collection link. And mine, obviously, I didn't send myself to collections, but it's empty. The reason I brought this forward because it is currently in my demographics under my billing. There's a collection in my collection agency. Okay. I didn't want to keep going into my demographics for a lot of stuff. So things like that were important for me, I brought to my dashboard. So I can click on there and pick the date they were sent to collections. And that'll be there. So they would now appear when I did my collections. If I was working my collections module, they would pull up on my in collections list. And I could sort them by the collection agency or the date. I have some pretty old stuff in there. But those are a lot of different parameters you can do and set up for yourself to work. Maybe you want to assign somebody in the office to work balances. You can actually put those filters in place and Yeah. Have somebody in your office sign somebody in your office and work that report.
Fantastic. Brooke, can you go into our smart sheet and talk a little bit about?
Absolutely. Smart sheet, ICD-10. Is everybody excited for ICD-10? I think I just heard a big groan. One of the wonderful features that we have for you is you're not going to have to know anything about ICD-10 at all. And that's because of our smart sheet. Our ICD-10 smart sheet is going to be like having every available ICD-10 at your fingertips. You won't have to know, what is it, 186,000 codes? And here's why. I have this, we all know, we're all pretty good, at least I think for the most part, knowing our ICD-9 codes. I can put in my ICD-9 and search, and it will bring up every code for that. So I can just find my correct code. There's my corns and calluses. Let me scroll down a little bit because that one came all the way to my bottom. There's that corns and calluses. By clicking my ICD-10, it's going to tell me exactly what my ICD-10 code is. That one's easy. That's a one-to-one. But when you get into things like fracture codes, what is it? Is it a closed fracture, open fracture? What am I doing? There's so many new codes for accidents and fractures and strains and all of that good stuff. So let's pick a closed fracture of a cuboid. If I click my ICD-10 button, I'm going to get this little warning box. That's going to tell me, oh wow, I need a 7th character. Okay, well, what is that? So let's come down to, it's bringing me into my neighborhood. These are fracture codes. It's going to tell me displaced or non-displaced. Okay, well, is it left or right? I still don't understand how you can have an unspecified foot, but you can. So let's go with displaced. Well, I'm picking that displaced, and there's that alert box again. What's the appropriate 7th character to be added? Is it open? Is it initial? Is it closed? Are we having routine, delayed heal? All of these things that we now need to report with these codes, it's telling me what I need. So we'll do an initial open one, and now I have the most specific 7 characters for that ICD-10. There's no way I'm ever going to remember what an S92.212B is. That's too hard. So this brings you to your code. So we call it the neighborhood. It brings you to your street, but this brings you right up and rings that front door. So that gives you the most specific code that you need. And this is what's going to make it for us so that we need to know little to nothing about ICD-10 because it's all going to be right there for us.
Fantastic, Brooke. Thank you so much. Like I said, we had several hundred people registered for this webinar today. So if anybody who typed in some questions who either didn't get an answer today, know that we're going to accumulate these questions, and we're going to put them up on our resources page. So anybody who didn't get a question answered today by Brooke, please know that we're going to get this all together. I want to thank everybody for joining us today. Just know that we are.
Dr. Bath,
yes.
I know a lot of times I get a question when I do that is how do people get gateway statements? TriZetto do their statements?
Sure.
And the integrated patient eligibility.
Okay. So.
The integrated patient eligibility, you can absolutely contact our sales department, and they will get you started and get that set up. For statements, and again, I can't say enough about their statements. They're fantastic, and the cost is just amazing, is to contact them directly. Fantastic.
Well, again, I want to thank you, Brooke, for taking the time out of your day to do this for everybody. Beginning shortly, you should also be receiving our newsletters to tell you that our Tuesday night series of webinars is going to be continuing in the coming months with some additional TRAKnet 3.0 training covering all the different areas of TRAKnet, including ICD-10 and our billing component again. So if you have any other questions, please feel free to reach out to us, reach out to your customer support representative at TRAKnet. The benefits of using our billing module and all the integrated features from TriZetto should be pretty self-explanatory. The integrated insurance eligibility, the ability to use TriZetto for your statements makes your workflow within your practice very, very simple.
And absolutely, downloading the remits electronically saves tons of time. I can tell you the one I downloaded while we were on today is an 8-page EOB. I just thought it took me literally seconds. And then I'll go through and look at it and see if there's anything I need to correct. But that takes that time and gives you back some time in your day.
Fantastic. Well, again, I want to thank you, Brooke, for taking time out of your day to join us on this webinar. Know that this has been recorded. It's going to get up onto our YouTube channel pretty quickly. And look for additional webinars and training sessions in the months coming. And thank you very much for joining us today. At this point, thank you, Brooke. We are adjourned. Thank you very much, everyone. Have a nice afternoon. Bye-bye.
Bye.